Hello, hello. Congratulations and celebrations. Super proud moment. I am extremely delighted to see you guys and this beautiful smile. Thank you very much, Aisha. Hello, Lisa. Hi, Mulia. Hello, Sumera. Thank you
Assalamu
so
alaikum, ma'am.
much. And the baby is here. Congratulations and celebrations.
Ajay.
Amrita, Harshita, Anu, Sana, Salma, Sabila, Savati, I am so very proud of you. Where to start from, Anu? So many happy faces, and I know that how much anxiety it had been since yesterday. How to start, where to start. I know the family will be over the moon, and I am super excited and so proud of you. Look at the babies there. And these were the same ones, yeah, who used to say, oh my God, mommy's studying all the time. How does it feel? Congratulations, my dear. Let us start with Sumera, whom I had to push through to take this exam and tell
True,
her
ma'am.
that, Sumera, let's do it. Let's do it. You will manage. Congratulations, my
Thank you
dear.
so much, ma'am. I have lot of to speak, and as you know that I failed my first attempt when I was in Malaysia, and I was sure that I will pass, but it Allah's time that I could not. Then you know that I was planned to have a cesarean section, and you messaged me on 23rd June that Sumera, I'm thinking about you. You will appear in the next attempt. And I said, no, ma'am, I can't. I will have a newborn baby. How I can? It is very difficult. But you will. You was after me. No, you have to do. You have to do. And by your motivational words, by your instructions, and my spouse support, Alhamdulillah, Allah has did a lot of mercy to me, and Alhamdulillah, I passed. Alhamdulillah.
I told you when you were traveling, and I was telling you at that time that, see, Sumera, it's not about, there's no guarantee no matter we study how much, this is how we have to give our best. And
Yes, ma'am.
when you were traveling, when it was postpartum time, of course, a newborn with you, then starting the job again,
Job also.
I just knew one thing that, see, we have to give our best. And I had faith in your, that consistency, that it's all right. You will manage no matter you're recovering after baby. I can't tell you that you're a big example for all those who actually become shaky after the first unsuccessful.
Yes. I became shaky. I became shaky that I cannot do at least in the next attempt. And you means messaged me and called me that no, Sumera, you have to do. You appeared in the exam, and you know that I could not revise all the syllabus again with having a 2 months old baby and 9 hours duty daily. But when I was in my exam, I just think that I am sitting in a clinic. I don't know these people. I am just handling my routine clinic case.
True.
And ma'am, above all, Allah's plan and everything, Alhamdulillah. But I am very, very, very thankful to you.
Thank you so
Without your support, without you pushing me, maybe it was not possible.
So grateful, Sumera, and your husband needs a big congrats, honestly, because I know how he had been,
Yes, ma'am.
rock solid
With
behind
me.
you. Exactly,
Yes.
because it becomes very difficult when one of the spouses, like, every day needs some sort of a support. And pay my regards to him and your parents as well, who have been so supportive
Alhamdulillah.
in your
Yes,
purparium
in
that
laws. My
in-laws,
father-in-law, my mother-in-law.
father-in-law. Yes,
Alhamdulillah,
very,
Alhamdulillah. I
very
am blessed in
supportive.
that time that those people made a lot of prayers for me, and I think so. I was able to pass because of their prayers also. And
Absolutely.
before going to exam center, I traveled on 9th. 10th was exam. On 8th, I told my husband that why I am doing all these things. I think I can't handle so much stress. He said, okay, relax. You just go and appear. Whatever will be the result, we will see it together. Don't
True,
worry. So
true.
those were the words that gave me motivation and remaining Allah's blessings. Alhamdulillah.
Absolutely. Congratulations to your kids. And
Thanks,
next
ma'am.
time when I'm coming to Riyadh,
We
lots and
will
lots
meet,
of
inshallah.
celebrations. But
Inshallah,
absolutely
ma'am.
lots of celebrations pending, my dear.
Inshallah.
Congratulations, my love. Thank you so much.
Thank you so
Thank
much.
you. Hello, Anu. Congratulations. Pagalu, can I request you? All right. Hi, Anu. Congratulations. Amulia, would you like to speak anything? Hello.
Hello, ma'am.
Congratulations, Winnie. When Winnie
Thank you
comes
so
out,
much, ma'am.
I'm so happy for you. So happy
I
for
don't
you.
know. I have never cleared one station with you when I was doing, I guess. It's all the motivation you have given me.
I'm
Hello.
so happy, Vinny. How are the feelings and how do you feel at the moment? I mean, what would you like to say to the upcoming aspirants and how do you define today yourself and your success?
Very, very happy, very feeling very blessed. I mean, some of my closest friends who are like really good have not passed. So I think it's just a matter of luck also.
True.
I don't think it is. all because of our hard work. Because I know some candidates who had put more hard work than me and still have not cleared. I'm
Good.
just grateful that I was on that luckier side, I think.
Absolutely. And I always say that it's about the timings, and
I
everybody has
know.
their time. So
Yeah.
it's just that we are not better than others, but it's just that that time clicked, or maybe that day clicked
Yeah.
to us. So it's definitely 50% of the hard work and the blessings are needed, my dear.
Yeah. Yes,
I
ma'am. I'm
always
so
remember
happy.
Winnie. I always remember Winnie in the headgear in the operation theater presenting, always in the operation theater in the scrubs and doing the live session. Lots of
It
fun.
was very. I have two kids, ma'am, and then I work in a hospital which is like a really really busy hospital in a government hospital in India. So it was really hectic, but I don't know. Somehow I cleared. All thanks to you and my study partners, I guess.
Thank you so much, Vinny, for choosing RFA, for being with me. And I remember you from part two questions at the end of the session until part three. And I'm so very proud of you. Oh, yes, the baby is here. Yeah. It's the day to speak. Let them speak today. We have already been making them quiet so much. Congratulations, baby. Mummy is a champion today. Thank you so much for helping Mummy to pass through all this exams. Thank you so
Yeah, I
much.
mean, it was so difficult for the kids also, ma'am. So I'm really thankful that I could clear it this time.
Congratulations, my love, and I'm very, very proud of you. What
Yeah.
would you like to say for the preparation for the upcoming aspirants, Winnie? Because you have been so thorough, asking questions always. If you're not clear about anything, you won't leave it. So, how did it
I
go?
think get
You
a
were
good.
active in both the regular and the fast track, right? Yeah.
Yes, yes, ma'am. I was active in both regular and fast track. My suggestion, like everybody says, part two you have cleared, your knowledge is thorough.
Yeah,
So you don't have to worry about the knowledge. Now is the time to build up your communication skills. Pick
absolutely.
a good partner. Find a good partner. Maybe like my strategy was to choose someone from who has a UK base. So my partner was Reshma since the beginning, and then
Yeah,
Reshma and Akanksha also added up. So we
yeah,
three used to practice together,
yeah,
and I think that practicing with each other helped a lot. That
absolutely.
is very very important. And then keep presenting in the classes when you're doing as an active role, because
True.
I mean, I think everybody knows I used to be really bad in every presentation which
I would not say.
I did in this one, because I don't know. You need to understand, and I think I got in when I started revising, I felt that everything started coming together,
True.
because part three preparation was way difficult than part two. I feel, ma'am, because it's all very anything can come, but still there are only certain stations which we prepare for. So it is like, yeah, but you need to get that knack to deal with whatever. And
Abs-
ultimately, if you know that you are dealing with you deal the station like how you are dealing your OPD case, I think
Absolutely.
you are
That is
passed.
that is the gist of clearing the OSCE. Thank you
Yes, and
so much.
in my exam, what I thought I was, ma'am, my day, majority of the things were communication based. I felt, ma'am.
Ooh.
I did on 10th. No,
Yeah,
sorry.
yeah. The second last day.
Uh,
Mm.
second last day I did it.
Yeah,
So
yeah.
all the stations were like communication related. Not
True.
many new stations that day, ma'am. But
Yeah.
that's what all were difficult patients. Some were crying, some were adamant. Those kind of
True.
patients were there. One drug addict was there, who was
Yeah.
very very adamant. So
Yeah.
what I felt was I could see the change in their role players' behavior by the
True.
end of the this one. So that way I felt okay. I have cleared the station, and
Yeah.
when I went to the next station, I knew that okay, this was fine, and I
Abs-
went past.
Absolutely.
But I'm a nervous
Congratulations.
spot.
And that's very natural. Exam is an exam, and we all are nervous. It's only that how you keep yourself composed and how you're better than others. Congratulations, Winnie, and
Thank you
congratulations to
so
the
much,
entire
ma'am.
family. So proud of you. Thank you
Thank you
so much.
so
If
much.
anybody is in a hurry, can take the turn earlier. Otherwise, I think this chit chat will go longer because we have got 100 plus passing candidates. And congratulations to all of you. Just in 30 minutes, we crossed 100 count, and all hats off to your efforts. If anybody is leaving, I would like them to speak early because I know that celebrations. Yes, Akika, congratulations, my dear. Ask me, you have always been a successful student. And ladies and gentlemen, would like to announce a figure of 80 touching in Mrcog 3 OSCE preparation and in the exam is is few. I'm sure that there are few in the world who have reached that, and Akika is one of them. Congratulations. So far, she's second position holder, third position holder, but we are still waiting for the results. But 80% is simply wow, Akika, and very well deserved. Very well deserved. You're mute, my dear. Click on the mic.
Yeah.
Congratulations.
Thank you, thank you, thank you, thank you, Safa. And
And how
to
you
say,
how do you
I
feel
mean,
today?
I'm on cloud nine. That's what they say. All the
Yeah.
young generation, they say. Actually, it's still I'm trying to imbibe because as the journey was not very easy. Actually, it's true that MRCOG 3 consumes more time than MRCOG 2 because in MRCOG 2, you just have to write. Here, you have to present and perform. Just on an instant, looking at the role player, trying to think what he or she is giving hint or what he or she is hiding, and then an examiner sitting on the other side. It's a whole different kind of an experience.
Yeah.
And I actually, result was out. It was there on my mail, and it took me 1 hour to open it. I was so scared. What if I am not able to get through? Because I think I don't know what else I could have done the way
True.
I did my exam.
True.
So
Absolutely. And
I
when we
was
were in Malaysia, just like one day before, even at that time, you were so beautifully prepared. It's just like the circumstances didn't let you prepare,
was
but you
yeah.
were all set, Akika. I told you there, and I remember your husband accompanying you, and you were all set to appear an exam. But sometimes the timings are not correct, but the
Actually,
preparation
it
was
comes
there,
when it
Akika.
comes. It took
Yeah.
me, when I was coming, when I was moving out of Malaysia, it was like it took me at least one more than a month to realize it was so
Hmm.
difficult to take it. Oh my
True.
God, it was just there. Why did I leave? Why did I leave? But
True.
then I'm happy, and I really want to thank Sidra, you, and everyone in the Salvation Group.
So
Uh, they were so nice, and Safa, Paglau, everyone was so good, and
yeah.
that group really
And even in the
helped
mock
us.
exam, they were like, more than Akika candidate, we felt that Akika is an examiner there. so, so proud of you. Very well deserved. Very well
So I
deserved.
it was really nice, the preparations and everything, and that period when you were doing, and obviously the group, and then the study partner, these all things really matter. And one good thing which I have started doing again in my OPDs also, I've started writing everything, like all the information gathering, which I don't know. I mean, the people who are in UK, they do it pretty well, but the ones who are there in India, we actually don't practice like that. And me being in practice for 20 years and then trying to, fill in the gaps and coming out, it was very nice. And I never thought that I'm going to do it. I started my journey in 23, and
Yeah.
in between I was taking break, and
Yeah.
now here I cleared everything. And
So
thanks to you, Sidra,
thank
and
you so
thanks to the
much.
team,
Thank you so much.
everyone was always supporting. That's
Yeah.
the plus point. They were not like, the word bullying. They were not bullying. They were always supporting. And that really helped. And I congratulate every one of us
Thank you so
because
much.
clearing
Thank
MRCOG 3 is a big thing.
Absolutely. Absolutely. It's a
Actually, it made
milestone.
me feel so good, and feeling like a student again. वैसे I think I'm far way senior to all of you, even to Sidra also. But and coming back to the student life and doing everything, thank you. I don't have words.
Congratulations, my dear.
I don't have
Congratulations
words.
means a
Thank you.
lot, and thank you very much for having all the parts with RFA. And I'm proud of you always for your efforts. And you're an example for all those who think that, no, this is not the right time. We have done our studies and we can't do that again. So there's no age limit, there's no
No,
experience.
no
You
age.
can anytime be a student again, and you can
Yes,
always,
I cleared my PG in 2005, girls, and it's been
yeah,
20 years.
yeah.
And I did it this now because I felt like doing it, and I really enjoyed the journey. I learned a lot. And I learned a lot with the team also. You need a push at this
Absolutely.
stage when you have such a big OPD, heavy OPD, running 2 hospitals, running 3 or 4 IVF centers. You need a push, and I got it from the group, from my Salvation Group, from all the colleagues, and from you. So 3 cheers for all of us, Safa,
Thank
and
you
thank
so much.
you, Sidra,
You
very much.
deserve this result. Thank you very much, Akika, and pay my regards to husband. Congratulations to entire
Thank you,
family, my dear. Thank you
thank
so much.
you,
Thank
thank you,
you.
thank you.
Aisha is
I will leave
smiling.
now
See
because
me.
I have some other things to do.
Very
Okay.
sure. Thank you so much, Akika, for being here. Thank you so much.
Bye.
Monica, congratulations.
Yeah, thank you,
So happy
ma'am.
for you. Where is Elizabeth? You both should be together. Yeah.
Yeah, ma'am,
Congratulations.
actually, I have no words to say. Like Ekika, I also passed my PG in 2004. And in 2012, I gave my first time I part one. And in 2017, again, I gave part two that I could not clear. Then I got to know of RFA through your students only. There is one Ritu who did 2 years back, and she motivated me, "Nee, ma'am, you do." She was my junior. So she motivated me, "Nee, ma'am, you join RFA, and RFA is really good." So my son was doing 10th. So I thought, ki, with him, I will also do my studies.
Right.
So both of us studied together. So in one go, then I did part two with your support, then part three. It was a great journey. I'm really, no words actually.
Thank you
I'm
so
really full of gratitude.
Thank you so
You, Safa ma'am, and Iram ma'am was so good, ma'am. She
Brilliant.
really, day, night, she worked with us. And
Absolutely.
I would like to say that whatever stations were there, it was all done in our schedule, in the fast track, in the active. I mean, the permutations and combinations were there.
Yeah.
Everything was there. I mean, because people used to tell me, no, 10 stations come like this, but 4 stations are new. But in my exam, I could not find anything that was new. Everything you covered, ma'am, in the active group and the fast track group, everything was covered. I mean, it came in the permutations and the combinations. So,
Thank
overwhelming journey. I'm
thank
so
you.
thankful to you.
So proud of you. When I received your phone call, I was like, Monica, you have made me proud. And the best thing was that you and Elizabeth studying together, so that gives really a confidence that, see, we studied together, we were buddies and we managed it.
Yeah.
So happy for both of you and congratulations, my dear.
Thank you
Congratulations.
so much, ma'am.
Thank you very
Thank
much
you.
for being with me in all the parts. And I'm so happy that you managed it in one go. And that's really a proud moment for me as a mentor for
No,
all of
that's because of you only. That's because of RFA. I mean, I used to listen from people that your voice rings, and that really is true. I mean, in part two also, I realize in part three also, that thing goes in the ears. Ma'am is saying that thing. So,
so much.
uh,
Means a lot, my dear. Thank you so much.
yeah,
Thank you.
thank you,
Aisha
ma'am.
Akbar, Suparna, if anybody is leaving, I know that you guys are. Rubab is here smiling.
Yes, ma'am.
Ma'am,
Yes, Suparna.
Yes, ma'am.
Congratulations, my dear Suparna.
Yes, hello, ma'am.
So
Thank you so
happy.
much. Really, alhamdulillah. Allah has been very kind, and I'm lucky to have you always as
Yes,
my lucky charm for passing my exams. Really,
always
thank you
there for
so
you.
much.
And when you shifted over from MRCP, no, 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 ma'am, I'll first complete this. So I was like, okay, let's take this. And then in the second slot, getting seat, Suparna. It was all
Yes,
fated
ma'am.
by Allah, I think, that you
Yes.
had
It
all
is
these steps.
sure, sure, ma'am. I agree with you. Everything is written for you, for each one of us, when you will cross the bridge. And once you do, I really feel very nice now at this age. Dr. Kikika was talking about age, but I think I'm the most senior one here. Still, I
Today we
passed.
are having a competition of age,
Yes,
guys. So
yes.
that means MRCOG has no limit, right?
No
Suparna.
limit of age, yes. I passed in 1993, ma'am, PG, so I'm eldest for all in your group.
Ekika,
But
if you're here, if
alhamdulillah.
you have not left, please, we've got another senior person than you, right?
Yes, ma'am, I'm
Suparna,
59
congratulations.
now.
So
So,
happy.
alhamdulillah, age is not a barrier. And if you have a
Absolutely.
mentor like you, ma'am, really your voice rings in the ears, and that is the moment. I think it's a, trump card for answering the questions. It really rings when you are answering. For me, it did happen. And I'm really thankful to you and all your
Thank you.
mentors with me. And I've been really thankful to all my colleagues whom I've been listening to. And of course, but not the least, it is Allah who has really taken the
It was
cake
written for you,
from me.
Suparna. I know
It's
you for
written
so
for me.
long. All this
Yes,
journey,
ma'am.
it was written for you, my
Yes.
dear.
Yes,
Thank you so
failures
much.
have reached the achievement point.
Absolutely. Remember
Thank you
in
so
prayers
much, ma'am.
always, my dear, and stay
Yes,
in touch.
ma'am.
Thank you
Please.
very much. We are
Yes,
still
ma'am.
to
Thank you
complete
so much.
MRCPI, yeah? Thank you so much.
Yes, ma'am. Thank you so much.
Always with you.
Thank you.
Thank you so much.
Congratulations to all
Congrats.
of you. Thank
Thank
you,
you so
ma'am.
much, my dear. Thank
Thank
you.
you.
Simi, Reshma, Aisha, who is going to be the next one?
Ma'am,
Hello, Reshma.
thank you. Thank you so much. This journey of MRCOG was very beautiful because I joined RFA, and I'm so thankful to you. And meeting, when I met Sidra ma'am in UK, I was so mesmerized by her, the way she conducts herself and the way she treats all of us. I'm so happy that I met you in person, and the not just the studies and the clinical knowledge. It's about how we treat others, how kind we have to be, how compassionate we have to be. And that was ringing more than any knowledge that she has imparted. So I'm so thankful to you. And I'm so thankful to God and to my study partners. Part two, it was Pooja and Vinita and Gangsha. I'm really, I don't know, like for me, it was like I couldn't manage my time much because I'm a new registrar who joined just the UK. It was very recent. So I have so many trainees working with me and who have not cleared the first time. So I was quite tensed because I didn't know if I would clear the first time, but it was just because of RFA that I did clear and God's grace. And I did bring my parents here. I sent my son back to India. It has been very difficult for me, but through the work, through the hectic schedules, I've really passed, and all glory to God and to all my friends. The trick is not just the knowledge that we have, it's about how we treat the patient as a whole. And that is what Sidra ma'am has imparted on me. And I really changed. I believe that MRCOG is not just a name that I have to add after my name. It is a lifestyle. It has really become a lifestyle. It has really changed how I treat patients, how I treat my colleagues, and how my practice has changed as a whole. So a big thanks to RFA. And if God wills, I would like to, be a part of RFA again because I love teaching. Teaching is my passion. And seeing Sidra ma'am, Safa ma'am, and Sunita ma'am, Pagolu, all of you, you've done a big wonders. Thank you so much. Thank you.
Thank you very much. I'm proud of my team. We are incomplete without each other, but at the end of the day, I'm so happy that you managed. In UK, passing in UK itself is a big thing, and the UK results have been so difficult. And in that, when you have managed this, I'm so very proud of
Thank
you,
you.
Reshma. And I still remember you doing the case and giving the feedback and going back, Reshma, see, this point is missing, this point is missing, and checking on you again and again till the end. But you have proved yourself to be consistent, and that's what I needed. It wasn't an easy journey, I know. It wasn't
Present.
easy being in NHS, working in the system, but at the end of the day, you managed with consistency, and I'm so very proud of you.
Thank you so
Congratulations.
much.
Yes.
Thank
See you
you.
soon in the next mock exam on the
Yeah.
other side of the
Yeah. Thank
thing.
you.
Yeah, thank you so
Soon.
much. Congratulations, my
God
dear.
willing. Yeah.
Congratulations. Thank you very
Thank
much. See me. Anjali, what would you like to say?
Yes, ma'am.
Simi, whenever comes in my, I was about to say, hello, I'm Simi. I'm one of the doctors in the clinic today. So I'm thinking that Simi is going to start the presentation now. How are you, my love? So happy to have you. Congratulations.
Ma'am, I'm very happy, ma'am. And actually, when I started with the part three, it looked like a very difficult task how I'm going to manage my time with the work, family, and the studying. Because it's not like the PG time in which you have all the time for yourself for studying. Now it's the studying is to the backstage, and
Absolutely.
so much of hard work we have put into this, and it's all because of the RFA. Because step by step, I've actually joined the long course. Like I took almost a
Yeah,
year to
remember.
prepare. So it
Yeah.
has really helped me step by step how I
But
could
you
get
didn't have a
time.
break. You were active there, and the moment it ended, you were active in the fast track as well, So you were presenting
Yes,
both
ma'am.
ways. So you didn't give a practice break in terms of speaking, isn't it? Yeah.
Actually, ma'am, when I listen to my old things when I started, I feel like laughing how I was doing.
Yeah, exactly. That's what I always tell you guys that when you are on the convocation stage, I feel like telling you, see, this was the actual start where we took and how better you were in the end of the fast track, isn't it? Yeah.
And even the group wise, Arita ma'am was there, and the live presentations yourself, Sidra ma'am and Safa ma'am, everybody has guided so beautifully. And part three towards the end, fast track was a little bit too fast for me.
True.
I found it little difficult to find
Cope up
time
with
and do
that.
it,
Yeah.
but
Yeah.
somehow I don't know by God's grace it's done. And another problem towards the end was the leave. I hardly got some 7 days leave towards the end, so I was quite worried. But when I started revising, I was thinking almost 250 stations are there, and how I'm going to revise. Then, by God's grace, I could do all those things. And exam also a little bit was difficult, but I was quite upset at the end of it.
Yeah, I
I,
remember. But you managed, see, you managed
yes,
because it's just like how you're better in the circuit. So I'm so proud of you and
yes,
congratulations, Simi. I'm so
okay,
happy that you managed it. And it was again with the difficult routine, everybody can do that. I'm sure that now
yes,
you will suggest to your juniors that it's doable, guys.
yes,
Just keep on moving, keep on practicing.
yes,
Yeah.
ma'am. Thank you for
Congratulations.
all your help and support, ma'am. You are an inspiration to everybody around. not only
Okay.
in this academic activities, for everywhere, how to behave with others. Actually, this journey, not only this degree, it has started halfway through. I was finding it like it's not going to make much difference to my job, which I'm doing. I'm not planning to go elsewhere, or it's not going to make a difference. But I could see the change in myself, like how I'm dealing with patients, how I'm communicating. Everything had a more professional and more dignified way of dealing and understanding the other people's problems. Like especially this breaking bad news and all, I could see in myself like how better I have become. So thank you so much, ma'am, for all
Thank you.
your help and support.
Means a lot, my dear. Congratulations to entire family and keep on
Thank you.
improving yourself. Keep on working hard. And now is the time that you pay back all this sacrifices of your family, pay back to them and spend time with them. Congratulations, my dear. Thank you
Thank
so
you,
much.
ma'am.
Thank you. Anjali, what would you like to say? I know that when you got a seat not in UAE and you had to travel, there was lots going on. Do you have a stable internet, my dear? Your video is breaking. Yeah, I've made an unmute.
Yes.
Congratulations, my dear. How do you feel
Yeah.
today?
Really tough journey for me, ma'am, because I have so much disturbance, hurdles in between. I have to relocate.
True. I think Anjali has internet issue. The video was shaking. I've got all the mentors here as well. Gori must be Safa's
Hello,
clinic time.
ma'am.
Gori's clinic time. Anybody wants to unmute Pagalu? Good to see you.
Ma'am,
Please unmute yourself. Hi, Aisha. Congratulations.
thank you so much, ma'am. You already know my story, how halfway in the course I
People
told
would
you.
like to know, people would like to know how Aisha managed it, guys, when we had opened the seats were open. Every second day in the first 1 week, Aisha was shifting to November batch, then May 26th batch, then November batch, then May 26th. And one day when she messaged me, ma'am, now it's final. Now I'm in May 26th. Can you please shift me? I said, is it final now? She said, yes, ma'am, it's final. Then we shifted her to the May 26th long batch, and suddenly 2 days later, she said, ma'am, now it's final, come back to November batch.
Yes,
I said,
it was
Aisha,
my
you're
husband
wasting.
actually.
I said, you're wasting time. What are you doing? Every 3, 4 days, we are shifting back and forth. What would you like to say? And today
Yeah.
you're MRCOG girl. Imagine yourself that, if it was me, of course, we don't have any guarantee. I
Yes.
told you the same, that we need to work hard. How do you feel?
Yes. Ma'am, like this time, 2024, I had like I have planned that I will pass part two in January 2026. That was what I was aiming for.
Yeah.
But because of you and my husband's support, I passed in July. And then, like, right after 3 months, I went for this exam. Obviously, I took a lot of time deciding May and November, May, November. But when finally I decided, I think that I cannot thank God enough that when I met this group, when I met you, it was only possible because of your constant support, ma'am. I swear, you don't need any UK based study partner. Even you don't need a study partner at all, even if you don't manage to get one. If you have one, it's right. But if they just listen to your crisp tutorials and practice, they are more than enough. Your voice kept ringing in my ears. I could, like, just go over the things that you told us. And like, I suffered a lot due to bad internet connections, due to my job, due to floods. So but even then, I am so happy that I made it. Thank you, Allah. Thank you, ma'am. And thank you to my husband, most of all, who was always there.
If he
And
was not there, it was very difficult for me to take decision for you. And
I
I
would
was
still
so,
be, yes.
yeah, because somebody has to be there, to push or keep
Yeah.
on reminding
To
you. So he
I
took
would
that.
say that anybody who wants to pass this exam, it's a doable exam. Don't look right or left. Just join Ma'am Sidra's group. Take the regular sessions, take the fast track, take the mock. Every session is worth it, honestly. Like, you don't have to go anywhere else. Thank you so much, ma'am. Thank you for everything.
Means a lot. Thank you very much. Being in Jeddah when you were performing, I was like, okay, now few days are left, and coming from Makkah, I remember everything. But the only thing
Yes.
which I would like to say is that once you decided, after that, you took it as a challenge, despite
Yes.
so much difficulties
So
in
much
the
difficulties.
country, in your own city, and then the workplace. but you managed to do mock exams. You managed to take the active, fast track, and regular. I'm so very
Yes.
proud of you.
Thank you
And
so much, ma'am.
again,
And I would just
this
love to meet you like as soon as
absolutely now.
possible.
Absolutely. Now this that was out of anxiety and stress when you were meeting me, and every day now, I'm sure that you would be having this feel that that was the moment when I took this decision.
Yes.
That was the blessed
Yes.
moment. And I'm
And
so
ma'am, one more thing, special thanks to ma'am Safa and Dr. Iram. Dr. Iram, I think she was the best moderator that one can hope for. She worked with us day and night, honestly, and her feedbacks were a huge help. So thank you, Dr. Iram. If
yes,
you're here, love you.
absolutely. Iram, I'm proud of her because the way she has taken you guys was like from ABC because the batch
Yes.
was starting. You just had your result and you jumped into part three.
Yes,
So I'm very
exactly.
proud of her efforts, and thank you so much for everything. Thank you, my dear.
Thank you, ma'am. Thank you so much.
Thank you. Yes, Saira is here. Zoya is here. Congratulations, Zoya. How did you manage to score so high? Congratulations from the
Thank
entire team
you.
of RFA Tutors, and we are so proud of you, Zoya.
Thank you, Dr. Sidra. Thank you so much. I don't know how I managed it. I just went and I just said, I'm just giving it my best and I'm leaving the rest to fate and Allah. That's all I did. And when I came out, you know how you reflect back and you're like, oh my God, I think I missed that. And I think I did that. And,
Yeah.
I was like, oh my God, I hope I didn't miss the bus this time. And then I just left it. And when the results started coming in, I was at clinic. And this has never happened to me. My heart started racing and my palms were sweating. I was actually having a panic attack. And I was like, oh my God, I don't have the strength to open this result because last time I just missed by like 4%.
I
And
remember.
I didn't even open it. I just mailed it to my husband and I was like, can you just open it? And then he opened it and he called me and he told me, and oh my God, my entire family is happy. And this has been my dad's dream since I was born, that he wanted
Oh,
me to be a
mashallah.
doctor. So he is losing his mind back home in Pakistan, anyways, and I'm here. But he's extremely happy, and I just wanted this for my family and my husband and my child, my entire in-laws. They've been so supportive throughout this journey. It's been insane. I can't thank them enough.
Absolutely. And doing all
And
this
all of you
with
guys.
87%, and that too in the UK center.
No,
You
no,
know,
I was in Abu Dhabi
Oh,
actually
you were in
this time.
UAE center, but that too, when you appeared,
Yeah,
you went from Ireland to there.
yeah.
87% guys in is overall in MRCT3 is a huge score. And
Thank
I
you.
think the center played its role, of course. I mean, at
Yeah.
times the luck is also there, but of course you had to be good in
No,
in
it's
the
all your
delivery.
guidance from you and all the mentors. The
It was
Salvation
really
group
good.
really gave us that boost. It
Yeah,
was
all the
much
salvation
needed.
mentors are here, and I'm so very
Yes.
proud of them that they're waiting
Thank
for
you,
the students.
everyone.
Yes,
Yeah,
ma'am.
Safa, you can
Hello.
unmute. Shabnam,
Yeah, yes,
Gauri,
ma'am.
the
I'm
top
here.
position holder is there. Where are you?
Yeah.
Safa, we can't
Congrats,
see
Dr.
you.
Zoya. This Salvation Group one, always, ma'am. Only
Yes,
four
my love.
candidates.
Yeah,
Daily,
exactly. This is the same
daily
batch
they
as
will
that
be
of who
presenting.
were presenting again and again, correct? This is the same
Again
batch
and
as
again, yes, ma'am. Yeah, yeah. Zoya, we will be calling, please come, Zoya. So, Sherry's come like this, ma'am.
Zoya was with Sarish, yes, Sarish, Mitri, and
Yeah,
they were together, I think so.
Yeah,
yeah.
exactly, Shabnam. Pagalu, congratulations, my dear. I'm so
Thank you
Thank
proud
you,
so
of
much,
all the
everyone.
ma'am.
mentors. Safa is the backbone. Can't say. I mean, I don't have to thank you. All know Pagalu is a gem. I see my reflection when
Thank
she
you so
counseled,
much,
and
ma'am.
then when I listen to her feedback, I always see, oh, somewhere I am speaking. She's my reflection always, and I'm so very proud of you. And Shabnam,
Thank
today I
you.
got a message that there's no mentor like Shabnam. She was your one-to-one student. So I would send you that message to you. I'm so very proud of your efforts. And as an organizer, as handling, Safa, hats off to you. How did you guys feel? Safa, did you feel when you were doing this? Because of course we know the students. Were you guys feeling that 87% would be like it's a huge score for part three? So did you guys?
Salvation Group students always we expect, ma'am. Every session I
Yeah.
used to tell them that we expect not a pass, always more than 80%.
Exactly, my love. Exactly. That's the aim, Paglu, that we do that this way, that they have to be stronger, Shabnam. But
They
the
all are very
motivation,
sincere also, madam.
Today,
They all are
today,
very
Dr. Safa,
sincere.
today, Dr. Safa added me in one group in the last moment. I just saw that it was a booster group and there was a lot of candidate there. I
Yeah.
was just tachycardic and I just that result is out. She messaged, no, this is old group. I was just like I was feeling that I'll start cry that
I
how many
know.
candidate are in the booster group
Yeah,
and
they actually all the batches together. We made them in the booster. They were all together, the regular, the fast
but
track, and
I was
everybody
missed
salvation.
in that group. That was the
Oh, I
previous
see. Paglu
batch,
was
and
there, I
I
think.
was
Yeah, Paglu
thinking
used to
that this
listen
is
to my voice
something
through the
new and
booster.
there is a lot of candidate.
Yeah.
When she told me that no, this is another group, and then I take a long breath that oh my God, thanks God, this is not something which
Congratulations, my dear. Oh, a lot to you guys. I always say I'm incomplete as a tiny, humble leader until unless the group strength is not there. And you all justify the standard and you make RFA complete. And I'm so very proud of you guys. Anything you would like to say to
Really,
that?
we are happy that ma'am, Dr. Ekika, Dr. Kitty, all the toppers, from our salvation.
Yeah, absolutely, my dear. Proud of you guys. And absolutely, it's always a
I told
pleasure.
Ekika in the Delhi mock exam, ma'am.
Yeah.
Ekika, minimum I expect at least 80% from you.
Yeah, I saw your message in the group and I was so proud of that. Congratulations, my dear. You guys deserve
Thank
the
you so
best.
much, ma'am.
And I'm
Your
so happy
guidance.
that you managed.
We are all
Always.
blessed that we are all trained under you. We are all mentored by you and Dr. Safa. And
Thank you.
today we carry that legacy. We are very much blessed, ma'am.
Thank you so much, my dear. It's just a shadow. It's just the love and the bonding we have, the faith we have, and the strength we have together.
Thank
Congratulations, my
you.
dearest. Thank you so much. Thank you. All right, Saira Atta, what would you like to say? Amulia is here. Oh my God,
Hi,
crying
ma'am.
girl. I was searching for tissue paper in the UAE mock exam. The girl was crying so much. Amulia, do you need a
No,
tissue
ma'am.
paper?
No,
Yeah?
no, I'm good. I mean, I've not digested it yet, but it feels very surreal, ma'am. The last time I was on an online meeting with you was at the Rise Up
I
in
know.
May, and now we're at the congratulations meet, and I'm like, so much has happened in this gap, and
True.
I decided not to give it another attempt because it was coming in the way of so many things in my life. But then I spoke to Safa mom, and Safa mom said just join the salvation, and we'll practice every day. And I don't know, it just hit me, and I joined the group, and I think that changed my life in a very big way.
Absolutely.
And I mean, all the mentors, Shabnam ma'am, Gori ma'am, Pagalu ma'am, Safa ma'am, Safa ma'am used to call me Amul baby. I needed to be confident. Amul baby, I needed to be confident. And Dr. Swati, who was my study partner, she used to be like,
Yeah,
I'll
Swati is
complain
here,
to
I
her.
think. Yeah, Swati, you're there, right?
I think
I saw
she's
her.
not here right now. Maybe
Okay,
she's
I
with the
saw her a
kids
little
now.
while earlier.
Yeah, but
Okay.
she used to blackmail me and say, I'll complain to Safa ma'am if you sound underconfident. And it feels very, very surreal, ma'am. And also very bittersweet that now, like, I don't have your recordings to listen to anymore.
Ah.
MRCOG 3 is done, and I'm like, in the UAE mock, I actually pinched Sidra ma'am. Are you really
Yeah.
for real?
Guys, she was sitting on the lunch table and she was like, Ma'am, you're in front of me. Ma'am, can I touch you? Ma'am, you're in front of me. I was like, oh, look at him. And then calling husband, look at Sidra ma'am is here. I said, calm down, girl. Breathe in, breathe out.
Yeah, it was like, you're always on the screen, so 2D, and to see you in real was like so surreal. And yeah, like, it was very beautiful, ma'am. All the entire experience from part one to now.
Yeah, I'm so
Thank
proud.
you so much,
And
ma'am.
I told
Thank
you that
you.
it's just a matter of time. It was just
Yeah.
that last moment that you had to be strong. That's it. And you were.
Yeah.
So, so
And
happy.
in the UAE mock, doing the 17 stations was the best thing that happened, ma'am, because in the real exam, I was like, 14 stations are over. I'm like, there's got to be more. Like,
Guys, I'll tell you the ones who don't know in the UAE mock, I had because more students, so I made 17 stations, right? So we had 17 stations, 34 candidates. So we thought that, okay, we'll start from one and we'll end at 14. But what happened was when they did 14, said, ma'am, why not please stretch? We are not in a hurry to go back. Please do complete 17. We did back to back 17 stations in one, then lunch break again 17. 34 station in one day after one day gap the exam was there and they were like messaging ma'am 14 stations are so easy in exam after doing
it
17 at a
really
stretch.
was, ma'am. It
Yeah.
was like after the 14 stations, I'm like, this feels short. Why does it feel short? And then I'm like, oh, because we did 17 just the day before. And like, I'm really, really thankful, ma'am, to everyone, especially my salvation batchmates.
True.
Uh,
True.
it was a really lovely thing. And
It's the luck to have good buddies.
yes,
It's a
yes,
blessing to have good support. And the idea behind our salvation is the same that, when you're a reset student, you lose the confidence over yourself, which should not be the
yeah,
case. But definitely we are humans. We need a push. We need a little more practice. We need support. And I'm so proud of all the mentors of the group, because it's just that I'm shadowing, but at the end of the day, the support they were giving, and at the end of the day, it's a smaller batch, so your bonding is very strong. So that makes the difference till the end of the day. Congratulations, Amulya.
thank you,
Congratulations.
ma'am. Thank
So,
you so much,
now
ma'am.
you have to come to UAE, and
Yes,
now you have to enjoy UAE, right? Without any exam stress.
yes,
Congratulations, my
yes.
dear. That's so
Thank you,
proud of
ma'am.
you.
Thank you
Thank
so
you very
much.
much.
Thank you.
Saira, what would
So
you like to say? I'm so happy to
Ma'am,
have you here.
ma'am,
And
I'm with you from RCPI, and from RCPI till now, I feel that I am blessed with such a nice mentor. Whenever I feel difficulty, I'm used to message, ma'am, what to do.
yeah,
Thing starting from the booking exam, when I didn't get the seat, I was sitting having tears in my eyes
that's
to
fine.
go to leave it. And then suddenly, ma'am said, don't leave the station, sit up there. And then I was able to book. Starting from the mock exam, it was your inspirational personality. Everything was so good. We are so blessed to have you with us. Always a symbol of love, kindness, professional attitude, with such a nice way that we don't feel that we are in a teaching area. We are just thinking that we are learning with so love and so care, where small things we are told about, do like this, don't do like this. I just think when I was giving tissues to my COV patient, it was coming to my mind. Ma'am said, Saira, in Jeddah, you will break bad news like this. I
Yeah.
was offering her the water. I was offering her tissues. Ma'am, your voice was ringing in our ears. Really, we are feeling so blessed.
Thank you so
From
much.
RCPI till now, I
Yes.
always feel that I don't need to look here and there. We are just connecting. Ma'am, what to do? Ma'am, is it okay?
Thank you so much. It's your
Stay
faith, my
blessed.
dear. It's
Lot of prayers for you to be
always
more
needed.
successful, to be
Always needed.
blessed more.
Thank you so
Thank you,
much. I'm
ma'am.
very humble, very sinful creature, not capable at all. I always say this is Allah's blessing that you guys are
Alhamdulillah.
successful.
Alhamdulillah.
It's your effort. I mean, I can just play the tiny role, or if any of the mentor is there, they can just play their tiny role. But at the end of the day, it's fated by the Almighty. So I'm never feeling that, taking the credit. But at the end of the day, it's your time was written for you, and I was just like a pathway through it. Just a pathway. That's it. I'm so
Ma'am,
grateful.
it would not have been that much easier if you were not guiding us in the way.
Yes,
You told us it is doable. You can do it. But do like this, do like that. We always remember this.
thank you so much.
Thank
I
you, ma'am. Thank you,
always
ma'am.
remember in prayer, Saira. Congratulations to the entire family. Thank you so much. Thank you.
Hi,
Ashwini,
ma'am.
there's a
Hi, ma'am.
baby. Hello. I
I
want to
want my
lift
baby
you
to see
up.
you.
Yeah. And I want to have a baby. Come on, come on, come on.
I
Congratulations.
wanted her to see you because she has seen you during the classes, but
Yeah.
definitely not. You have not never seen her. But
Yeah.
I just want to say thank you, ma'am. Thank you so much for being there with me.
So happy.
Ever since the part 2 journey, I couldn't get in May, but I did get a seat in November. So I'm glad I got to give the attempt and under your guidance, and thankful to you.
Thank you very much. What would you like to say as, for a toddler's mommy, or when the kids are smaller,
I would
students are still
I was just actually during the session I just got a call from two of my friends who are stuck in their journey to towards MRCOG, and their kid is bigger than mine. So I was just telling them, you don't have to do anything, just join RFA. I was just telling her the same thing. Don't do anything, just join RFA. You'll be able to clear.
Thank you so much. This
Yeah.
this happens,
Thank you.
I was
Thank
just
you.
telling Safa a little while earlier that the moment result came, lots of
Hmm.
questions from different groups, started coming. We want to join, we want to join. So it's the word of
Hmm.
mouth actually, that students they keep on coming. So
But
again,
it gets so concise because we don't understand from where to start, where to till where to take it. And because of your guidance, actually, we know. Like even when I was giving the exam, I could feel that this is a borderline station that I've done, or this is a good station that because of your
yeah,
feedbacks
feedback.
actually.
Mhm.
So that was really helpful. And I would suggest that be active during the regular and the fast track classes, because
Correct.
that really makes a lot of difference the
That
moment
actually puts the
you start.
pressure, you know. I always tell the listeners the same. It's not about listening, it's about speaking. And then
Yes,
speaking
yes,
and
that
making
makes a lot
mistakes.
of a difference.
Absolutely. Making mistakes and then coming back and doing the
Mhm.
correction, you know. So at the end of the day,
Yeah,
the more you
yeah.
speak, the more mistakes you make, you get better. So
Yes,
this
she
was
was with
always,
me during the exam. She was there in Abu
oh,
Dhabi.
oh,
Though
that's
she was
love.
not with me at the center, but she was there.
Yeah. Yeah, I'm
So
so proud of you. And baby should enjoy now. She should get some gifts and toys. Mommy is a
yes, yes.
cinema.
Ever after the exam, she doesn't want me around actually. Before the exam, she always wanted to be
This
with
is
me.
what kids they always do. Yeah, this is what they come to know that now parents are busy, you know, and they would just
Yes,
ask all the demands, and after that they're happy within themselves when parents are free, isn't it?
yes, yes.
Yeah.
That is what she's doing.
Congratulations, my dear.
Thank you
I'm
so
so
much, ma'am.
happy and so proud of you. Thank you for choosing RFA, and we are blessed to have mentees like
Ma'am,
you.
I'll
Thank
be
you.
messaging you regarding my future plans. I had
Sure,
to talk to you
absolutely. Just
about
send me
that.
the message,
So
and we are going
yes,
to have
I'll.
all the
Yeah.
discussion, my dear. Thank you so
Thank
much.
you, ma'am. Thank you so
Thank you,
much.
my
Okay,
love.
bye,
Thank you so
baby.
much. Bye bye,
Thank you.
baby. See you.
Thank,
Bye bye. Lots of love. Rohini,
thank you.
Rohini,
Thank you, ma'am.
love. Where are you? Love, the way you have made part three, I am so proud of you. Rohini, want to hug you.
So, ma'am.
I remember your 17 stations, and I was like, oh my God, how did you do it, girl? I'm so proud of you. So proud of you, Rohini.
The mock exam was a real eye opener, ma'am.
Mhm.
Because I don't know, it really shook me. I just realized that the way you practice at home and the way you
Yeah,
practice in a real exam, it's very different.
true.
So the whole
And
mock exam
you remember doing my station, and I was like, oh, what are you doing, Rohini? I'm
was
like
so
shaking.
bad.
What are you doing?
It was so bad. I was like, I was completely sure that I'm going to fail. But
Mhm.
then doing the mock exam gave me the confidence. And then even in the real exam, the first two stations were bad. And
Mhm.
then going forward, I started freelancing. And then
Oh.
that can only happen because of the way we've practiced during the sessions. So I was just, I just went with the flow, and the other stations were good after that. The first two, three stations were so bad. But
So
then,
like
ma'am, yeah.
like Amulia was saying that 17 stations made a difference, you know, doing the stretch and doing all the
Yeah,
way. So did it make a
it did.
difference? Yeah.
Huge difference, huge difference. After even in the real exam, after the 14th station, I went to the next station. I'm just standing there, and then
Uh-huh, then the
someone
15th one
came.
would come up, yeah.
Yeah, and someone, one of my friends, she came and said, "It's over. Let's go now." And then we went.
I understand, my dear.
It
What
was
would you
so
like to say, Rohini? You have been consistent, but you were fluctuating in your presentations, like as a mentor.
yeah, yeah,
I would not say that outrightly from the start you were perfect, but you
yeah,
reached to a level of perfection, you know? If you ask
yes,
me, I
yes,
could see the change in your improvement in your speech, in your understanding. How did you cope up? How you used to improve yourself? Because you were quite different in starting, and you took a
yeah,
quite big leap, I would say, to reach to the success.
yes.
How did you improve yours?
It's because of my study partners, Iram
Yeah.
ma'am. Everyone was so nice. It's like Iram ma'am was just, she was so good. I have no words for her because in between I even stopped studying, and then I
Yeah.
started studying again because of her.
And she used to
And
message me for you, you know, for the feedbacks and ma'am, how is she
yeah,
doing? And she used to
I
ask me about
know.
after the regular session. Yeah. So
She
you had a
was
good
so
chemistry with
sweet.
your moderator. Mm-hmm.
Yeah, and even my study partners, they were all so supportive, so helpful. So
Mm-hmm.
I used to practice a lot. Towards the end, I started practicing a lot, and it really helped. And just listening to the classes and then practicing on my own, it really helped. Because in
That's
the exam is a completely different world. You don't know what's happening.
true. It just goes on and goes on and goes on, correct? I
Yeah,
mean,
and it's so noisy. I couldn't. Towards the end, I don't think the examiners could even hear me. I was just trying to scream, but there was no voice coming out. But RFE tutors was, I could. It was amazing. I didn't take anything else. Few people suggested take a few other courses, do it side by side, but I didn't do anything else. I just did RFE. That's it.
and
So
that's
yeah,
that's what
it
I
was
always tell
amazing.
students that at the end of the day, if you're able to comprehend, absorb, and then reproduce the content, the job is
Yeah,
done. Many a
yeah,
times you're in too many things, but at the end of the day, you're not able to reproduce and you become, shaky inside. So whatever
yes,
it
ma'am.
is, everybody is amazing. They're doing a great job. But at the end of the day, just absorb and recall and reproduce the data. So if you're able to do that, you do the job and
Yeah,
you're confident
yes,
within
ma'am.
yourself. Yeah.
And going in with an
Congratulations.
open mind. going in with an
Exactly.
open mind, because each station is so different, and it's just about presence of
This
mind
is
and
the
just
biggest mistake which people are doing. And when I have the moderator discussion, often we are discussing, I'm sure if Safa is there, she will also agree to that. You know, what happens is when you're making the mock exam stations as well, we try to put so many things together, you know, like
yeah,
we want to make the student realize that role player can come up with anything. Please don't be
yeah,
occupied. Don't
yeah,
be occupied that we know it's a so-called, recall station. There's nothing
yeah,
like a recall station. The topics are there, but the role player
yeah,
can be very different. It's how you
yeah,
understand, how you speak, how you manage them, and you're able to, handle or negotiate. If you have these skills, you can handle everything. I mean, PMS is a PMS,
yes,
but
ma'am.
it can come in 12 different ways. Premenstrual syndrome can be 12
Yeah,
different ways.
yeah,
The problem is that if we understand, okay, yes, we know that as it is, this is PMS, and then we get occupied and we don't listen to the role play. So here we
yeah,
lose the
yes, ma'am.
exam.
Yeah.
So
And even during the station, if something doesn't go the way you wanted to go, it's just about completing the station according to the template. Just completing it itself gives you a score, because the first station did not go well for me, because it was we had a dysmenorrhea patient, and
yeah,
when
I've
I
heard.
asked her, I specifically asked her, did you have pain in every cycle? She said no. So then again it threw me off track. I think she said that
Yeah.
to almost everybody there. So it was very confusing. So even if that happens, it's fine. You can still just push through,
Don't
complete the
worry.
template, and you can
Exactly.
still clear it.
Exactly. You keep the
Yeah.
domains in your mind, you keep the sections in your mind, and you move
Yeah.
ahead.
Yeah.
Very well done, Rohini. I'm so
Thank you
happy.
so much, ma'am. I'm
You,
going to miss RFA tutors. I'm going to miss
oh,
you.
no, no.
Everybody.
You guys are always on the Insta stories and looking at this and replying to me.
Yeah.
So always staying connected with you guys with all
I
these.
wanted to speak to you when I saw you at the Abu Dhabi mock, but I was too shy to talk to you.
Oh,
So,
I'm so grateful.
and yeah, so
Yeah,
it was
actually, I
so
think
good
that
to
respect
see.
element is there. So always when you guys are there, you're like, "Oh, it's ma'am," but I'm just
Yeah.
just like a normal creature like you guys. But I'm so happy that we managed to meet and you came all the way for the mock exam in the UAE, and it was a huge success. Such a spectacular results for the UAE mock
Once.
exam. In fact,
Yeah.
all the mock exams, Delhi, Chennai, and UK, despite being so difficult exam. So proud of you, Rohini. Stay in
Thank you
touch,
so
my
much.
dear, and we love you
Yes.
so much.
Thank you
And
so
you've
much.
always been part of Alumni. And stay in touch, my love. Thank you so much.
Thank you
Thank
so
you.
much, ma'am. Thank you.
Thank you. So we were talking here. There's one student of mine whom from the start I call her Love. And even in the part two, I used to send a heart in the chat box. Hello, Love. How are you, Love? I love your name because your parents named you Love. And I'm so proud of Love. She is one of my ambassador for her country, guys. I mean, there's a group, and every time Love would be sending me lots of students. Yes, and I'm so proud of you, Love, for this starting the journey in the last moment and deciding that no, I'm going to take exam in November. How did you
I'm
do that?
telling
So proud of you.
you, I couldn't have done it without you, ma. I couldn't have done it without you. I prepared for this exam in 6 weeks.
Ask me.
6 weeks.
As a
Yes.
mentor, I know that.
Yes. I came to your DP and I told you, see, I want to do this exam, but it was a difficult decision for me. Can I make it? Is it possible that I would pass? You tell me, love, if you decide that you will pass, you can do it. And I took that word from you and I decided to start preparing. 6 weeks. I didn't think it would be possible, but with your encouragement and the team, I was able to pull through. Another thing that was very material was it was about just preparation. I went through all the topics we discussed in fast track one by one. But I went through them like 3 times, all of them, and I made sure I discussed them by myself. That was one thing that was very helpful. I made sure I talked, I spoke, I presented every single recall in that fast track. There is no one that I didn't miss anyone at all. So that was what was very helpful to me. And over the time, I was able to manage my time. Time management was also a good thing. In examination, I was able to finish in good time. It was my last station that I didn't finish on time. But I was able, in fact, I got to know when 3 minutes has passed for history taking. I got to know when it's time to move to the next one. I was not timing myself anymore, but I was able to finish in 10 minutes. So that was what I got from constant practicing. So that's what I would advise people that are coming up. practice, 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 and then time yourself. You know, at a point you told us that my history taking was taking too long. 5 minutes, I was still taking history, but over the time, I was able to get my history in 3 minutes. And, in fact, I had a lot of time. And in fact, the exam was easy for me in the sense that they were they were not new questions, but I was able to know where they were coming from and all the clauses and all of that. Like one of the questions that we got was migraine. I didn't think I practiced migraine during my practice, but somehow because of the pro forma we had on how to approach the question, I was able to, attack the question like that. And the patient asked me, I'm taking topiramate. Should I continue? I didn't know what to say, but I told her, I'm sorry, I'm not very sure. How about if I check my medication book later and I'll get back to you? And that was what saved me in that station. I was like, I wasn't sure whether topiramate was safe in pregnancy or not, but I remember patient safety. When you are not sure, tell them you are not sure. They will not kill you. So that was what I did. I said, I am not sure, but I will check and I'll get back to you. And at that time, I was like, I will get my consultant to see you, and I'm sure he will also discuss that with you. That was what I said, and they were nodding their head. In fact, I was so happy that, like the secret is get the format, the pro format, how to address it. And there is no topic. Even if you used to tell us that even if you don't know the diagnosis, if you're able to follow in the stepwise direction on how to approach it, that you're able to, still play safe and get your points. And that was very helpful to me. So in fact, I dedicate my success to you. This is the shortest exam I have prepared in a short while. And I'm so glad that I made it. And it was my first sitting. 6 weeks. I didn't think it was possible. Well, with Sidra Ali, it was possible. So I'm so grateful to you and the team members. And I appreciate every other person in the group. Through your presentation, I was also able to support myself, my learning. I got information, tips from every one of you in one way or the other. I couldn't have done it alone without all of you. I appreciate you. Thank you so much, ma. Thank
Thank
you.
you so much, love. You're always in heart. I would like to say to everybody that despite me being in part two, when love used to ask question, I was always, then because of love, always I receive messages. I am love's junior, I am love's friend, or I'm some hospital colleague. All the Nigerians, they came, there's so many in the group. I mean, my Malaysians, my Hong Kong, Singapore students, but after that, I've got a very strong place in Nigeria, but I think she's amongst those who has spread such a word of mouth for RFA in Nigeria that at the moment in part two, there's so many juniors of yours, love, and so many friends who tell that I'm love. And when she contacted me, I was just saying that to myself that I wish love told me earlier that she wants to appear because 6 weeks. Honestly, I have not seen anybody to prepare. But as a mentor, I couldn't say to her when she had so much of a passion to take exam, I couldn't say to her that love, let's take May 26th. I didn't have that courage. I said, okay, she wants to do it. Let me give my best and let's see that how she responds. So I wanted to have the probation time for myself as a mentor that how would she do? But she started coming up with questions in the first fast track. I started seeing her attending the live session early in the morning, 5 a.m. GMT. And I was like, okay, now love is on the track. Now she's improving. So it was all your hard work, my dear. For me as a mentor, 6 weeks is near to impossible to feed everything, to make you speak. But you took it as a challenge, like people, what they have done in 4 months or 6 months, love, you have done it in 6 weeks. Because you
Yes.
gave your, I think, 200%. I'm so
Yes.
proud. So
Thank
proud.
you, ma'am. I'm so
I,
grateful.
I cannot tell that this, if I still say that it was something near to impossible, that will be true because I'm yet to see anybody that who would just take it as a challenge and perform it. And all my love and gratitude to all my Nigerian community, and I'm so very
Thank you.
proud of you. You
Thank you,
are a
ma'am.
role model for everybody. Thank
Thank
you so
you.
much.
Thank you,
Congratulations
ma'am.
once again.
Thank
Thank you so
you.
much. Thank
Thank
you.
you.
Rubab, congratulations. That hug says it all. I was
Hello,
holding your
ma'am.
hand and telling you, Rubab, you are scoring more than 70%. I was so happy when you did the mock exam, and I'm so
Yes,
proud.
ma'am. Yeah, ma'am. It was all the mock and all the stations were repeated. All of the stations that we covered in the fast track, the salvation, the intense, and I took all the courses of RFA.
Yeah,
Yes, ma'am. And
okay.
yeah, and thank to all of the mentors, Dr. Safa, you, ma'am, and Dr. Shabnam, and everyone. They helped us so much.
Yeah, absolutely. I'm so happy when you came to the mock exam and you were so smooth. I didn't find any difficulty in, like, your fumbling. The words were coming up so spontaneous, like a well-practiced candidate. How did you
Yeah.
manage that, and what would you like to suggest to the upcoming aspirants, Rubab?
Yeah, ma'am. I always suggested even my juniors and my friends, they have joined the part two courses. Like Sarah, she has also joined. So, ma'am,
Yes.
I always told all of my colleagues and then to join all the courses of RFA. I joined the intense, I joined the salvation, I joined the fast track, and I joined the regular course. So all of the
And the mock
courses I
exam,
joined,
everything.
and the
Yeah,
mock exam. Yes, ma'am. Yeah,
yeah.
and the mock too. Yeah,
I could see you in all the courses, and I could see you strongly
yeah,
participating in all the courses, Rupab. So
yeah,
this was
yeah,
this was one effort which everybody can do, like in terms of giving 100%. And I'm so
yeah.
proud of you. At the end, you were very, very well prepared, my dear. So of course we need blessings, but
Yes, ma'am. Yeah.
how would like your juniors or the upcoming aspirants, that how can they crack MRCOG 3 with a good preparation, especially the me aspirants who are quite anxious nowadays?
Yes, ma'am. Ma'am, I think with RFA and with good practice, it is possible. And it was my first attempt, and I
Yeah,
did it.
yeah,
Yeah,
alhamdulillah for
yeah,
that, my dear. So lots of congrats from the entire team, each and every moderator of Salvation and Intense. We are so proud of you, me being fast track, listening to you again and again, and meeting you in
yeah.
person. I'm so very proud of you, my dear.
Thank you so
Congratulations.
much, ma'am. Thank
Thank
you.
you so
Thank
much.
you.
Pavitra, hello. Pavitra, hello. Hi, my Myanmar. A, are you there? Shaza, congratulations.
Yeah,
So happy to see you.
yes.
Hello, A, how are you? So happy, my
Fine,
dear.
ma'am.
Your exam
Yeah.
was in the first day in UAE or the second day?
Yeah. Second day, ma'am.
Second day.
Yeah.
Congratulations, A. How did
Yeah.
how did it happen? You traveled all the time, all the way coming to UAE and then attending the mock exam. How did it feel, my
Yeah.
love?
Actually, at first, I do not have the no confidence, but I don't know exactly what is wrong or the words I said are wrong or right. But after the mock exam, all the examiners said that they are pleased, and they also encourage outside the cubicle also each amender, and then and after the mock exam, I'm pre. This is I wanna be. This is a real exam, and actually, the mock exam is also totally nearly 100% the same like the exam, real exam also. Yeah.
Yeah, so that was something which really helped you. We tried to mimic as close so that you have a full dress rehearsal for that. And how did you feel when you were taking the exam? Did you feel better in your confidence? And how did you find the UAE center as well? Lots of students they asked that, and especially traveling through Myanmar and a little, communication difficulty as well. How did you feel the center?
I think the good center because the patients are well communicate with me, and I have not got at English, but I can
Yeah.
understand well, and also I think they will also understand my English as well, and the best thing is that I attend the mock exam in the UAE because it gives a lot of confidence. Yeah,
Absolutely.
yeah.
I have got a memory of yours in my home office. I'll show you that. Do you remember me? You brought something for me. Yeah,
Yeah,
I'm going to
yeah,
show that to everybody, guys. This was in the
yeah,
mock exam when A brought this, and I think it was a name written as well, right? Yes.
yeah,
So I was so
yeah,
happy on when you reached up this. It was written on this. A lots of love from Myanmar, guys, and I was so happy that she made all this. I don't know whether you guys are able to see that or not, right?
yeah,
Thank you so much
yeah.
for this love and this
I really
beautiful
want
gift.
to see you outside. I'm
I
really
still have it and
happy.
it's hanging on my home office. You know that? Yeah. So with your name and all, congratulations. You have
Yeah,
made complete A, and you're again a role model for all my Myanmar students in the community who work hard and always are a little, shaky to appear and exam in other centers. I'm so very proud of you. Congratulations, my dear.
thank you, mom. Thank
Thank
you. Yeah, yeah.
Shaza, congratulations. I am so proud of you.
Thank
All
you
those who
so
have
much.
appeared and cleared in UK. salute to them and hats off.
Thank
I
you
mean,
so much. I had so much panic, but I mean, without your efforts, you've been absolutely amazing. We really cannot thank you enough. We really cannot thank you enough.
thank you for attending the mock exam, and I'm so proud of you the way you have done. I'm so happy the way you have managed. What would you like to say to the upcoming aspirants?
Up immediately for RFA. You know, you have had several attempts before. They all failed. And you know what? Until I started studying with you, I'm like, oh my God, what did I do to myself? I should have signed up much earlier because it does have a technique. It does have like you drew our attention to so many important points and so many important things on how to behave in the exam and how to speak to the patient. And although I practice in the UK and I'm quite confident in my practice, but it was very important to sign up to your course. So I cannot thank you enough. And
Thank
I
you
feel
so
lucky
much.
that I came across someone who recommended joining RFA.
Thank you so much. And seeing you in the mock exam, meeting you in person means a lot, my dear Shaza. And next time, do see me in London mock exam. And I'm so grateful that you've always been a big support and you've always been working hard on the shortcomings. So taking the feedback positively. Congratulations, my dear.
Thank you so much.
Congratulations.
Thank you
So
so much.
proud
All
of
the
you.
best. Wish you
Thank
all
you
the
so
best.
much. Thank
Wish
you.
you all the best.
Congratulations. Thank you so much. All right, so who is left here? Let's have the participants, and here we go. Sorry if my screen is. Hello, Pavitra. So happy.
Hello.
Congratulations, my dearest.
Oh,
So happy.
thank you so much, ma'am. Thank
So,
you so much, ma'am.
how do you feel?
Really,
Every
because
single
ma'am.
moment shaking, Pavitra. You'll be okay. You'll be fine. How did you feel, my dear? So happy for you.
Yes, ma'am. I'm really very thankful to you and Safa, ma'am. I really am very shocked with the result, ma'am. It was really, I'm feeling so happy, ma'am. I can't even tell in words. It was really a very big journey, ma'am. Part two, then part three, and initially I was strong with the applied clinical knowledge, ma'am, but it was really very difficult with the communication. And I still remember the first early pregnancy class. I was feeling very tense that I didn't even speak up, ma'am. It took a lot of time to come up, and with each and every session, I found the difference, ma'am. Like with each session, I was improving, ma'am, and only during the fast track, I was able to speak, ma'am, that I was able to complete the task, ma'am, by 10 minutes. Oh, it was really a very big journey, ma'am.
Understandable, my dear, but I could see you improving every time, and I could see you that yes, you're working hard on yourself. So that was the main thing. And I'm so happy that you managed it, and you didn't lose hope even on corrections, on fumbling. There was time in the start, Pavitra, you used to stop during the station. That, ma'am, I cannot do it. Ma'am, I'm not able to speak. And I had to tell you that it's okay. Come up, gear up again. Let's do it again. And I'm so happy that you managed this. And you're amongst those who were not very confident with the journey of MRCT in the beginning in the terms of communication and terms of fumbling, but you managed it so strongly. I'm so proud of
So,
you. I'm so
because
proud
of
of you.
you, yes,
What
ma'am.
would you like
And
to
really,
say? What
yes,
would you
ma'am.
like to
Actually,
say?
yes, ma'am. It's we should be very scheduled, ma'am. Like coming to a schedule, like each topic wise, we should study, and we should keep on revising the old recalls. And at least premium sessions I did once, and the fast track I did twice before, and I got only 2 weeks leave, ma'am. With the work and balancing work and studies, it was really very hard, but somewhat I found time and I gave in Mumbai, ma'am. It was a little bit difficult, but I was able to give, ma'am. It's
I'm
all because
very
of
happy for you. You're an example, and you are a role model for all those who say that no, 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 it has to be, perfect English. It has to be better. So I'm so happy that you managed, and I'm so proud of you, my dear.
Thank
Thank you
you,
so
ma'am.
much.
Thank you.
Congratulations to entire family, and congratulations from all of us. Thank you. Thank you.
Thank you so much, ma'am. I'm really very happy to have you as a mentor, ma'am.
Thank you so
Thank you
much.
so
So
much, ma'am.
happy. Meet
Thank you.
meet you soon someday. Thank you so much, my dearest. Thank you.
Sure, ma'am. Thank you, ma'am.
Anybody else left from the champions? Lots of champions already. I'm still receiving the NHS messages of the passing students. I'm so happy. Hello. Hi, Hadil. How are you?
Fine. Hello, Dr. Sidra.
So much.
I don't know what to say. I don't know how to thank you, Dr. Sidra. I remember the first time when I talked to you when I want to register for the long course, when I told you that my problem is my language. It's a big barrier. It can affect my communication.
Yeah.
So told me, don't take this as a problem. So we will work together and really work together. Thank you, Dr. Safa. All of you, thank you. Love
Thank
you
you so
all.
much. I'm so grateful, Hadeem. Thank you for making us proud. Thank you for reaching to this point and bringing smiles on our faces. I'm so grateful to you for choosing RFA and having faith in us. Again, it was your effort. We just were guiding you and you absorbed it and you practiced it more. Very well deserved. Very well
Thank
deserved.
you, Doctor. Thank you very much. Thank you.
Thank you, my dearest.
Thank
Thank
you.
you very much. All right. Thank you very much, everyone. I think, Safa, what would you like to say in the congrats meet? And all those who have not been able to be successful, there are messages coming up from different parts of the world. There are time and it's all written for us. These
Yes,
students, many of them, Safa, they were in the Rise Up meet as well. So I would like to say it's never a full stop if you want
yeah.
if you want to continue. What would you say, my
Yes,
dear?
ma'am. Yes, ma'am. Actually, I'm really happy that many students today had a very good time
Successful
and
result.
they are very happy and
Yeah.
enjoying this moment. But few of the students, these students, they had a very bad time 6 months
Earlier.
back and
Exactly.
they didn't give up.
True. True.
They come up with a good spirit and they practiced and and finally they did it the same
True.
way. It will be there for everyone
True.
has their own time for celebration.
Absolutely, absolutely. And I always say that it's not about A is there as an example, and I know that we all work hard. We are never perfect. I always speak for MRCOG3, I always speak that nobody can be successful without hard work. Definitely we need to prepare, definitely we need to put in practice and hard work, but there is a chance that you prepare and you're not successful. So it's different. You have to prepare to be successful, but there is a chance that you prepare your 100%, but you're not because centers unfortunately count. The day counts. At times, the day is difficult. For the other day, many times students they say, "Ma'am, if I was on day one, I could have done better." It's just that day, that time. Because OSCE definitely is luck. We need blessings. So it's not the time when you guys put a full stop to your practice. It's just that you take your time. Of course, we all need time to gather up ourselves. But at the end of the day, because we see so many people who are today successful and they have their background stories, which we know. So it's just a matter of time. It's just a matter of being strong and rising up again. So for all those who have been successful, hello Gori, how are you, my dear? So you congratulations to you, my dear. And students have been so
Thank
happy
you,
from the
Samudra.
entire back.
Congratulations to you also, and really, really very happy to see the result.
Yeah.
Overall, yes, as Dr. Safa say, overall it was a good result, but really still few students which we know they did hard work. That as you nicely said that yes, it is all about luck and day performance, and center
True.
also definitely like today UK students had a very tough time. We can understand on all the time. We
Yeah.
know that UK is always tough.
Always
But
tough, Gori.
overall, yes, I would say congratulations to all of our students who really did the hard work, their dedication, their patience really today paid off. And we know that whenever result is due or near, we start taking cardia more than
Exactly. Exactly. For the last 2, 3 days, MRCP OSCE result is coming up and MRCUG, we start having tachycardia as if like we are appearing again every
yes,
time.
yes,
So it is like that
every
good.
time. Yes, I agree. Yeah.
Congratulations for
Yeah.
all your students.
Thank you.
Congratulations for being part of one of the lead mentor at RFA. And I'm so proud of you guys. Safa, Pagalu, Shabnam, Gori, Anita, all my moderators, Namita, Iram. If I'm missing out anybody, everyone, please. We are so happy because even if you have given a one feedback, Sunita, one feedback if you have given and that has improved the student, you definitely have paid your role. And wholehearted thanks from me as a lead, from the backend team, all the support they have been giving. We are incomplete day and night, checking the access, taking care of their technical problems. All the moderators in the group, it's very difficult 24/7 replying to the messages, and especially near to exam. Then all of them being guided by the moderators at every time. in the live sessions when I'm giving the feedback, connecting to the moderators, that please work on this element for this specific active participant so that we can work together and next time she's better. We are totally, all of us are incomplete if it's not a team. And I'm so grateful. Thank you very much to all of you and looking
Ma'am,
forward.
just a
Yes,
few
my love.
persons will be joining now,
Okay,
ma'am.
they're joining now. All right, I'm
Yeah.
sure. Okay, Sharmila, I think, joined Safa, my love.
Yeah, yes, ma'am.
Yeah,
Sharmi
hello,
joined.
Sharmila. Congratulations. Actually, I thought that they all are busy in the. Can't have. Hello. Hi.
We
So
can't miss,
happy.
no, ma'am.
Yeah,
We
exactly.
have
We
talked with
can't
Pavitra.
miss.
If you are missing Sharmi, then Sharmi will be asking, ma'am, you didn't call me.
Yeah, you didn't call me, Sharmi. How are you? Congratulations.
Thank
Need to
you
hug
so
you
much,
tight.
ma'am.
So happy, my
Thank you so
love.
much.
So happy.
Without RFA, this cannot be possible at all
I know.
because my family is in abroad. So this is one of my important task, the next task.
My dear.
So I just believed in RFA from the beginning of my part one. I just came succeedingly in every 6 months, no repeat.
No
And
problem.
also, I was already told in this
Back to back,
second
ma'am.
part
Back to
also,
back.
yeah. Second part also, I told that just believe in RFA, nothing else. I need not think anything whether I'm going in right path or not. Just we can hold the hands of RFA and we can walk. They will take us to the success path. The thing is that we should follow them. And I have to tell that all the mentors of RFA are very hard workers, especially Dr. Sidra ma'am in the fast track. She was sitting the whole day. I was thinking how she could sit in the
Exactly.
whole
When I
day,
used to
starting
enter the
from
fast track, Safa used to message me, ma'am, please take care of your back, ma'am, please take care of it.
yeah.
I said, fast track is going to be like this, and then I'm going to be in the prone position. But I'm happy that you guys were this time, when I did all the crisp recordings and everything, you guys were so
Yeah.
happy, and it was really very good to revise for you
Yeah,
guys.
that was the same energy. You are there from the beginning to the last of the day, and you gave opportunities for everybody to present as much as possible, ma'am. Thank you so much. And with Safa, ma'am, she is our boost up. Whenever we get low, she will boost up from the base and she will bring up that you can do. And we did in the Chennai mock also, and we are
Yeah,
eager to meet you all, ma'am. Thank you
yeah.
so much.
Shamila, would you like to tell the story from starting up? When was your part one, part two, part three? And how did you manage the shift over and transformation for the students who want to take it back to back, my love? Starting from part
Yeah,
one.
yeah, actually, I don't remember the year exactly, but it was
Today, no year we'll be remembering, correct? That's understandable. So, part two
yeah,
and part three, and back to back switching
yeah,
over.
just in 6 months in the
No,
first
she
attempt
took,
itself.
I'm telling,
So
ma'am, she took last time January, part one,
See,
ma'am. Then
look
July,
at
part
look at
this is our teacher, see.
Yes, Appa, tell the years, please. Yeah.
No. Last January, she took part two. Then in May, actually, I asked her to give exam. She told that no, I can't give exam immediately. I will
Yeah.
take time, and she is one of the student in 116.
Yeah. No. That's what we know. I was telling her that okay, if the students they want to give a gap and consecutive taking part one, part two, and part three back to back.
She was
Actually,
giving continuously July, then
continuous,
January, then
exactly.
Yeah,
November.
July and then yes, ma'am. So
Yeah.
actually, giving a break is difficult. Much when going through successively, it is very easy because we can have the knowledge of the basics and the guidelines will be in our mind. So the part three is applying our guidelines to the patient, the clinical knowledge. So better we can go in successively. It is very much. Comfortable when leaving a gap that we can do it later on, because later on means the guidelines everything will change, and also we will also get tired. Just to hold the hands of RFA team, and we can just walk with them, they will take us to the success, I think. So that is what should be in our mind, and we should be dedicated to the studies also, apart from any distractions. That's all.
Absolutely, absolutely. Distraction
And
should not be there.
we should
Consistency should
yeah.
be there. Thank you so much, Sharmila, for being part of us. You're amongst those whom we can proudly say that we have carried you as a baby and, made you reach to this
Yes,
step.
yes.
And you've always been amongst those who are not looking right or left and always having faith and, connectivity with your mentors. Because I always say mentor-mentee relationship is very, very important,
Yes, ma'am.
and that gives
Because
strength.
you will give feedback regarding everybody's individual performance. When I was presenting, you told me that you are going in, your emotions should come, your voice is like a flat, and you should talk loudly. So that is very important for individual feedback. So I started to improve on my emotions because the patient's
I
emotions.
have notebook for each active participant, and then then I keep that in the MacBook. And then when I see that, okay, last time this was the note which I have to work upon, then I make your graphs. And that's so important because there's so many different sections of the active participant. So then I see that, okay, this time and in comparison to the previous feedback, how did you guys do? If you see this, oh my God, every single participant list is always in my study and that's always on the desk. Then I write points for myself that here they need improvement. And I think this is what is important, that I say that new mistakes are welcome, but the older mistakes should not be there. So, you start working hard and you see others as well improving, then you get a little boost. I'm so proud of you that you worked on it positively. There are many students who start feeling negative after the feedback, that, oh, we can't do that, we have made a mistake. But you were always open to it. No, ma'am, please tell me more. What can I do? Ma'am, please, can you please tell me more? So that's a very positive attitude, my dear. And I'm so
Yes.
proud of you for all the efforts.
Thank you,
Congratulations.
ma'am. Thank you, Safa ma'am. And thank you all the mentors and my
Thank you.
colleagues.
Thank you so much.
And one more person is there, ma'am, Shishma.
Shishma joined? I didn't see her, my love. Shishma, you there?
Good evening, ma'am. Yes, ma'am. Yes, ma'am. Good evening, ma'am.
Hello, how are you? Congratulations, my dearest. I'm
Thank you
so
so much,
I
ma'am.
had to
Sidra
pray
ma'am,
to
Safa ma'am,
opening.
all thanks from my heart, from the bottom of my heart,
I
ma'am.
can't
This moment
see
is
your
really
your
very emotional for me. Ma'am,
Shushma,
actually,
open
I'm
up
on
your.
the road. I'm traveling. I
Oh,
can't
I
open up my camera right now. I'm sorry,
no,
ma'am.
no problem, no problem. Your voice is enough for us to celebrate, my dear. Please let us know, how do you feel today? I'm sure that it will be an emotional moment for you.
Sidra ma'am and Safa ma'am, I really can't thank you enough. Actually, when I completed my exam, I was crying because I didn't reach what I expected. In the mock, I did better, ma'am. I thought I'll be doing better than that in the final exam, but
Yeah.
like important points like incident report and all, I forgot. I got to remember them only after I came out of the exam hall and I started crying because that's an important patient safety point. But
I know.
luckily, with God's grace, all that passed by, and I really can't thank enough from the bottom of my heart, ma'am. Like,
Thank you,
like I
Meeta.
got no words to express.
Thank you so much,
Safa
Meeta.
ma'am, yourself,
Thank you so much.
Sunita ma'am, Pagolu ma'am, all these have been continuously guiding, ma'am. Shabnam ma'am and Gori ma'am. So many ma'ams. Namita ma'am.
Yeah, thank you so
Everybody
much.
was
They
so
all are
helpful, ma'am.
amazing, and each one of them have played their outstanding role, I would say. And we are so incomplete without each other. And I always say that it can
And
never be a
at this moment, ma'am, I would also like to thank my study partner, Dr. Sandhya. She's been so supportive. She's been so supportive, ma'am. And
absolute.
without her, I might not have really gotten this far, ma'am. She was the one who always motivated me to study.
Understandable, my dear. And again, I would say that it's never a one-man show. It's always combined efforts, and together as a team
Yes,
that
ma'am.
you've made it stronger. At the end of the day, it's your efforts, and I'm happy that you were consistent on this. Congratulations,
Thank you so
Shushma,
much,
from
ma'am.
all of
Thank
us.
you, ma'am.
Thank you so much. Thank
Thank you,
you.
ma'am.
Hello, Dimple. Hi, Harshita. Is it
Ma'am,
the same
Swati is
Harshita?
there.
Samati, I think she. Hello, Samati. Samati's been there in the beginning, Safa, in the starting. Yeah. Dimple, Harshita.
Yes, ma'am, I'm here.
Hi, hello. Is it the same Harshita of UAE Mock?
Yes, ma'am, I'm same Harshita.
Hello, can't see you, my dear.
Yes, ma'am, I'm home. Yeah.
Yay! Congratulations. Now I
Thank
see
you,
I had
thanks.
two Harshitas. That's why I was asking. Congratulations, my dear. So
Thank you
happy
so
for
much,
you.
ma'am. Thank you
I
so
see
much.
that group photo of UAE. That's part of the fast track MRCG2 Jan 26 DP, the first picture. So every time when I open, you guys are in front of me, the UAE mock exam people. I'm so proud of you, Harshita. How do you feel today?
Yeah, it was very good, ma'am, actually. In fact, I was very confused whether to take exam in November or July because I'm not a talkative person all the time. But somehow, I felt at the end, I was like, okay, initially I felt it is very difficult to manage MRCOG Part 3. I didn't feel 1 and 2 is so much difficult. Since it is ASCII, I was feeling very difficult. because in India they don't give much concentration to OSCE so much. So, but later with initially I was supposed to be a listener group, but you made me to active group actually later. It helped
Your
me a
practice
lot,
is
and
active.
to face person to person, it gave me more confidence, and even mock also, ma'am. By the end of the mock exam, I was like little more confident compared to the beginning. At the end, I was okay, ma'am, actually. So thank God and thank our FA team, because I cleared exam at first attempt.
I'm so proud of you. I still remember that you were missing out the active participations, and I had to tell you that, please, Harshita, where are you? Every time tagging in the ABC group, Harshita, you there? Harshita, you there?
Yes,
And
ma'am.
just trying to make you come, because that was the inner thing. Okay, let's escape. Avoid the active avoid the participation today. So don't want to speak. So I had to always pull you and encourage you for
Yes,
that.
ma'am.
But I think
Yes.
mock exam for you was a little boost.
Yes, ma'am. Yes, yes.
That's
And
good.
all the, mentors are very good, ma'am, actually. Um, I was like very happy. Thank you.
No worries. Thank you so much. Means a lot, my dear. Thank you so much. Thank you.
Thank you, ma'am.
Dimple, Savati, would you like to say something? Hello. Hello. You're mute, my love. Hi, Savati.
Yeah,
I
hi, ma'am.
remember sending the voice notes going in the morning, walking, and Savati's voice note would come, ma'am. I'm feeling very low, ma'am. And I'll send one voice note and scold Savati. Savati, now no more second thought. How do you feel today? I'm so happy for you, my dear. Congratulations.
Yeah, actually, to be very honest, like I thought I'd not check my results. I like my study partner this time was Amulya, so I told her I'm not going to check my emails, and probably once I put the kids to sleep, then only I'm all going to check the email. Whether actually I have received the email, because initially the people who were not clearing usually they get the emails.
Yeah.
So I was like, I'm going to check it, and even if it is there, not there, maybe around 8:39 night, I will check it. So I was very sure that I'm not going to. I picked up the kids from the school, and then I came back, and then initially I was seeing the people who had not cleared, and then when the pass candidates started writing coming up, then I was like, okay, let me just check it. And then when I checked, then I immediately called up Amulya, and then she called me, and then I called everybody. I was like, okay, like that anxiety is over. Maybe the feeling which I'm getting right now is not very I would have been much more happier had it been the first attempt, because it was twice the stress.
Understandable.
And initially in the first part, yeah, I mean it was two times going to the same thing. But yes, ma'am, it is definitely, yeah, no more
But
reading.
I would
Family
like you
needs
to
to.
see the part of the picture or side of the picture that what if it wasn't again, So God had been really kind. So if it was second time, because we know people who have had one of the UK students, she's been not been able to be successful for 4 times, and in the part two course again. So unfortunate things, they do happen, my love, and I am so glad that you managed. Though you were absolutely the type of the student who were clear passing last time as well. I do understand you were not the type of the student whom should be, because in communication, in practice, in confidence, in consistency, always I see your notes and writing down the points, listening to my records, everything. But at times, our again, the moment is written, it's fated, and this was for you, Savati. But you've always been very consistent, and I think you are amongst those who are always following the stories and motivations and asking for, thumbs up and hearts on the Instagram. So always looking at the positive part, Savati. So proud of you. What would you like to say to the upcoming aspirants, my love?
Ma'am, it's always a fight. We have to fight, like how you told, fight up till the last station. So even if we have, like, there's been a station or two we have not done very nice, like
True.
still we can make the
We can make a
difference.
comeback.
So,
True.
yes, we can make a comeback.
True.
So never get disappointed if one or two stations haven't gone fine. Just fight for it. Make sure, because the next station is going to be altogether a different thing, different scenarios, a different clinical applied knowledge. So even if we have not been able to do it in the stations, we can always cover up.
Absolutely. And this is what I always say, that the next examiner doesn't know until unless you're so shaky that you tell them, see, my previous station wasn't good. So always be confident in the next and just leave the baggage. And that's the beautiful advice I always give to all the mentees. Congratulations, my dear. Lots
Yes.
of love for kids. And I'm so proud of you being a strong mentee, and always making a comeback, my dear. Very well done for that. Thank you so
Thank you
much.
so much. Much more regards for you, Safa ma'am, and the entire Salvation Group tutors, like mentors. They've always been there. They've like anytime, any query, and especially Safa ma'am to she's been. After I got the result, I immediately called her on voice. Like she congratulated. Told her I am going to come to Coimbatore because I am also staying in Tamil Nadu in India, like the same state. So I told catch up and I'm going to come and meet you. She was always very supportive. Like whatsoever may happen, she'll be like, no, I can do it. I know you can do it. And your
Absolutely.
voice recording, the one you had sent me before exam, ma'am, I just heard it. I used to maybe whenever I used to feel upset, I used to always listen to that voice recording that sometimes things are not meant to happen at that moment. So don't think about it. Maybe the others who cleared along who appeared and cleared with you, maybe your preparation would have been better. But sometimes it's the luck which matters. And I was so disappointed. I was so disheartened after I received my result for the first time. But yes, then my husband, my family, and my kids were like, okay, we'll just give it one more shot. If you feel that if it is supposed to be with regards to your luck, then not every time it is not going to favor you.
Absolutely. Absolutely.
Yeah, if you feel that your preparation in the first attempt itself was good, then obviously it is not going to go anytime lower than that.
Absolutely
Maybe
correct.
so just give it
Correct.
your shot, and I did, ma'am.
Thank you so much. I'm so proud of you, and I'm so happy that today we are meeting in the Success Meet. Congratulations, my dear. Thank you so much. Thank you. Dimple, oh, I can see Elizabeth here as well. So happy. I was waiting for you, Elizabeth. I'm sure again it would be the clinic time and busy obstetrician would be there sitting in, and oh, she's home. That's lovely, Elizabeth. Can't tell you the happiness. I mean, the first phone call that, ma'am, I would take, and then counseling you for part 2, then part 3, ma'am, shall I take it now? No, no, I will take it May 26.
Yes.
So proud of you.
Yes, ma'am. If I could do it at a go, there can be only one person for that. That's it, Riley, the mentor. Nothing more than that, ma'am. I was always doubtful whether I should go in July, but you said you can go for it. This is how you should do it. And you just gave me, you had more confidence in me than I had in me myself. And I think that was the biggest power that I had, ma'am. I have no words. RFA Tutors was amazing. My journey in MRCOG was for me, this degree per se doesn't mean much. I mean, didn't mean like something like that because I am already, sort of established and very busy practitioner, sort of, with so many other extracurricular activities too. But I just took it up because I wanted some knowledge out of it. But then when I reached after one stage to the other, then it was becoming really, I mean, how can I explain that to you, ma'am? With RFA tutors, it really made a big difference. And all your voice notes, all your positivity, whenever, I had that, fear whether I'm doing the right thing, I should give some more time, whether I'll be able to do it. You can do it. You should do it. This is the time to do it. So absolutely, hats off, ma'am, to the entire team. I met Safa at Coimbatore once at the Sopsy this thing, and I was so I can't express how much happy I was. And I pray to God I would like to meet you also someday to really tell you how much this means to me. It's a big wish list ticked. Something I would have done 25 years back when I cleared from PGI Chandigarh as the topper. But then I went into practice and so many other things which prevented me to even dream this dream, ma'am. But I'm so happy that I could do it, and no words. Heartfelt thanks to each one of you at RFA Tutors. Always will be indebted to you. This MRCOG is definitely our RFA Tutors.
Thank you so much, Elizabeth. I remember the checklist you used to tell me that, ma'am, when I start from morning, I have to do this much patience, and I have to do my
Yeah.
then I have to do this, then I have to do my teachings, then I have to do my extracurricular, then I have to attend the conferences. And then I asked only one question, when would you study? No, ma'am, I'll manage after 8 p.m. And I was like, okay. So this was part 2 thing. And then when the pathway came, I said, Elizabeth, I talked to you. Please do it. Please do it. And let's try. We were aiming for the UAE, and then for India.
Correct.
And
Yes,
every
ma'am.
step I was like having a chat with you, but it's just like I
Yes.
had to give you what do you say, a protection. Just a
Correct,
protection.
correct.
You were, I would
Absolutely,
not
yes.
say that it was because of me, because you were very well deserved. You were very, but you were just like needing a, holding hand, I think.
Yeah,
I
correct,
just
ma'am.
helped
To
when I.
get that confidence and to get that this thing that you can do it. And what I understood from this exam, ma'am, it is the smart learning that matters. So
True.
that you cannot the portion is so vast, nobody can get all that into your mind. So
Absolutely.
through this, the mentors, the RFA tutors, we can understand the smart learning and learn that points which will make you pass. That is the passing thing, and for that you have to be very consistent with the course.
Absolutely. I'm so grateful that you were in regular, you were in fast track, and you did
Yeah.
everything on your tips, and you had
Yes,
faith in
yes.
us
Yeah,
as
yeah,
well.
yes, ma'am, very well done, Dr. Elizabeth, ma'am. Actually, she did it with one go. That
Yeah,
too,
exactly.
very fast.
That's what I'm saying. All back to back. And Safa, I knew that she would do it, but it's the only thing I expected from her was that, of course, with a busy routine, you can't just leave your established practice for this exam, which is not going to make a difference in your, in
Correct,
your working.
correct.
So when
Yeah,
first
correct.
time when we talked, you told me about everything, and I told you. And in fact, you were having lots of options with you. I said, no, Liz,
Correct, correct.
just
I
give me
discussed
your
all
time.
that with you actually. Yeah.
I know, and we had a 30 minutes good time on the phone
Yes,
call, and
yes,
I
yes.
understood everything about you, and then I told one thing that see, I'll stand besides you, but then you'll not be shaky. I'll make sure that you each do it. And that
Yeah,
day and
correct,
today, I'm so
correct, correct,
happy that
correct,
it managed. And even through the part three, whenever you were being slow,
correct,
I had to bring
correct,
you back. Elizabeth,
correct,
don't forget.
correct, correct.
Don't forget
By
why
the
we
time
started.
the part three ending came, I got little bit drained out,
I
ma'am. But then
remember.
somehow I could get back onto track. I can't tell you.
True.
Really, because yeah.
And
Anyways, thank
and
you so
one
much.
another big thing is that you had a very good partner, Dr. Monica,
Yeah.
and yourself. You
Absolutely,
see,
ma'am. Monica,
And I'm so
last.
happy both of you passed when she immediately when
Yes.
she called me after the result and you messaged me. I was happy that both the buddies
Yeah,
because I
yes,
could
ma'am.
see they were
Last
growing.
1 week, we did, daily we did the combined. We covered
Yeah.
the entire portions.
Oh,
Actually, 1 week, I have no words for Monica. She was really very, very much
such
helpful
a
for me.
sweet partner and such an
Very,
honest
yes,
one that
yes,
really
yes.
matters a lot.
Yeah, very genuine, ma'am. Very genuine.
Very
We'll
genuine.
definitely meet up. We have told we'll meet up.
Absolutely, absolutely. So RFA brings hearts together, isn't it? Yeah. So you are
Correct.
in different
Absolutely.
parts of the world and you become friends,
True. Yes,
and
ma'am.
so lots
True.
of hearts together, and then you stand besides each other. Thank you
Correct.
so much, Elizabeth. I can't
Thank
tell
you.
you the happiness, and no matter whatever I say, it feels like an accomplishment for me because I think
Correct.
I was that forcing power behind like no, you have to
Correct.
take it, and then
Yes,
taking the decision
yes.
for your November. It was a burden
Yes,
on me.
yes, ma'am. Yes, ma'am. I was very much confused whether I should take it now or in May.
Yeah, two
Thank you
times you
so
said
much.
that, ma'am, shift me to the May. I said, calm down.
Correct.
Just,
Correct,
I'm not going
correct.
to shift you to the May, please. Calm down, just manage. And you missed your first active participations, two or three. I still remember you were,
Correct, 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 correct.
but
Correct, ma'am. I've
God
missed.
has been kind and you
Very
deserved.
much kind.
You deserved it, my dear. Very well
Thank you
done.
so much,
So
ma'am.
happy for
Thank you.
you. And I'm waiting that beautiful sari of yours, which is going to
Yeah,
have
I
a
will.
testimonial.
Yeah,
And I
definitely.
always see that, the beautiful Elizabeth sitting up and then speaking heart out. Congratulations. And RFA is always there for you, my dear.
Yes, yes, ma'am. Surely I'll be doing it, ma'am.
Thank you so much. Take very
Thank you.
good care of
Thank you.
yourself.
Thank
Thank you. Hello, Dimple.
Hello,
Dimple,
ma'am.
Dimple,
Hello, ma'am.
congratulations. So
Thank you,
happy for you.
ma'am.
We need to see the camera. People need to see beautiful
Ma-
smile. And still we are not done. Oh my God, so long list and people are not there. Hi, Dimple, congratulations. How do you feel today?
Ma'am, it's still sinking in.
Still feeling that, oh my God, let me see the email again. Is it
Yeah,
mine?
yeah, yeah. Actually,
Okay.
ma'am, I was mostly a silent participant.
I
I had not
know.
practiced much, and I started just 1 month back only. So I was not expecting that I would clear it in first attempt, but it's all because of RFA.
So
I
grateful,
owe this
Dimple.
completely to RFA.
Thank you so much. Means a lot, my love. So, what would you like to say if you're a quiet sort of a person, not a very talkative person, and not very practicing as well? How did you manage the exam stress?
Ma'am, I just followed word by word whatever was taught. Whatever
Love.
was taught by you and the entire RFA team, I just followed it religiously, and I practiced myself only. I did not have I was not active in the groups and all,
True,
but
true.
I just followed everything whatever was
But there are
told.
many type of students who are comfortable with themselves in the mirror, rather than others.
Yes,
And I
yes,
think they
ma'am.
absorb better. Their
Also,
retention is also better.
Yes, ma'am. Also because of the duties and all, so
True.
it was a bit difficult to have
Time
that
management.
synergy.
Yeah.
Yes, ma'am. Yes.
Mm.
So yes, so I was not at all expecting that I would be able to do it in first attempt.
So that means that it's been really a blessed day for you. And I'm so
Yes, ma'am.
happy that you
Definitely.
managed it in one go. And it's just a beautiful way that despite just being a good listener, you had such a beautiful absorbing capacity, my love.
Yes, ma'am.
Congratulations from the entire team, and
Thank
it means
you
a
so
lot.
much, ma'am.
Thank you very much.
Thank
Thank
you,
you.
ma'am.
Thank you so much, everyone. We've got a huge list. I don't know how much the list would have been. When I started the congrats meet, I had 110 in front of me, but my iPhone is full of popped up messages, especially the UK students. They often message privately rather than in the group. So the team is still making the results. Again, at the end of the day, I would say it's maybe partially our efforts or maybe less percent from our side. At the end of the day, it's your efforts, and you all very well deserved all this. Whatever you have reached up till now at this point, you have put in your hard work, you've put in your sacrifices. We are just giving you a platform, a guiding source to give you the reach to your final destination. We are not complete without your faith. We are not complete without each other. Again, a big congrats to all of you, your families. Thank you so much for being part of RFA Tutors. Thank you so much for having faith in us. All those who are successful today, enjoy the best and do not forget, even if the tiny contribution, if you have from anybody, may that be your mom, may that be your dad, may that be your husband, may that be your wife, may that be your kids, may that be any colleague in the hospital, your study buddy, or the tiny mentors here at RFA, always remember and pay them back. The life is all about give and take. The life is always about remembering that somebody helped you in your difficult time and remember them in prayers. Because at the end of the day, this time is all temporary, everything is temporary, and it's just like going to pass. But the gratitude, the love, the prayers, they always keep on coming, and the blessings, they are always needed in life. The ones who are not able to be successful, I would like to say again, it's never the end of life. It's never the end until unless you make it an end. Start again, take your 24 hours, 48 hours, and start with full enthusiasm, keeping in view that it's okay. Next would be my time. I would stay consistent. I would not think that it's one time I couldn't be successful. Just think that it wasn't my time and it was just a trial, and the next time I'm going to be successful. Work hard without any fear, because it doesn't affect anybody, but it affects you, your family members. So do it for yourself, do it for your mentors, do for your family members, and above all, for your own satisfaction and contentment. May the Almighty be with you guys, all the happiness be with you guys. Congratulations to my backend team, congratulations to my coordinators, to all the moderators, the website team. Congratulations to all of the mentors of Intense, Salvation, Fast Track, Regular, Last Minute, who had been putting in day and night hard work. Again, we are incomplete without each other, and me as a tiny, humble leader just in front of you guys, representing each and every one. Congratulations from all of us to you and your families, and thank you very much for having faith in RFA Tutors. Love you guys. Take very good care. Thank you very much for all those who have been from the start of the meeting. It's been a marathon. Thank you, Gauri. Thank you very much, Safa. Thank you very much, Dimple. Akshaja Grigar, I just saw you now. Did you join now?
Yes,
Hello.
Yeah,
I'm
Dr.
sorry.
Akshaja just
Hi.
joined. Yes, ma'am.
I still thought that
Akshaja.
somebody is missing. Hello. Congratulations, my love. How do you feel
Thank you,
today?
ma'am. Thank you so much.
Yeah, we were seeing in the group. Are you comfortable?
Yeah.
Oh, okay, can see
Yes,
you
yes.
now. Congratulations. How do you feel
Thank
today?
you.
How is the family's response?
They're all really very, very happy. And
Sure.
ma'am, I have to say that the kind of support that is given by RFE tutors, your messages, it's so constant, and it doesn't end at the exam. It goes on till after the results, and it's just amazing, ma'am. I have been with you people since my MRCOG too, and I'm so grateful to everything. The moderator, the intensive course, it was extremely amazing. I have to give credits to everyone for that.
Absolutely. I know
Thank
the
you so
hard
much.
work. I know that how much effort is being done at the back end, but it's all because of you guys that you guys support, you guys put in effort, and I'm so grateful for all the love. Thank you so much. Thank you.
So much.
Take very good care of yourself. And oh my God. Safa MRCP OSCE result is released. Started receiving the
Okay.
calls. Okay, just now. Okay, thank you so much, everyone. I think we just need to come up to this, and we are receiving the messages for the MRCP OSCE and back to back Banmi and all for the Ireland. So I think we are going to have another success meet in a little while. Thank you so much. I love you guys. Take very good care of yourself. Thank you very much. Be right back with another success meet. MRCP OSCE results are released. Thank you. Bye bye, everybody, and congratulations to all of you once again. Thank you so much. Thank you.